Hello and welcome to the Tuesday, June 23rd edition of the Situation Report for Thunder Bay Regional Health Sciences Center's COVID-19 response. My name is Tracie Smith. I'm here with Incident Manager Dr. Stuart Kennedy. Dr. Kennedy, so we have entered the next phase of our recovery, and we're aiming to increase services such as elective surgeries and diagnostic testing. How are things going so far?
So this is great news for a lot of the patients in the region and Thunder Bay now that we're sort of opening up our recovery phase, especially surgery and outpatient procedures, which really have a significant backlog over the past 4 months as we've been dealing with the pandemic, and things are going well. Certainly, we're still not at full capacity. And certainly that will be a challenge to get to full capacity because there's certain guidelines we have to follow. And certainly we need to make sure our PPE supply is adequate. And right now it is. But we still have to use conservative measures that we cannot just ad lib, as far as using all the PPE supply we have, because we must take those conservative measures to make sure we are able to preserve it if we do get a second wave. And also, because of the worldwide demand, the PPE supply is still short, so we still have some difficulties securing enough PPE supply, but it is being replenished at a fairly regular basis, not the high volume we require, but it still is a concern both with the gowns, the gloves, the N95 masks, as well as our drugs and medications. So we're on top of it. We have enough supply, but our concern is how long that supply is sustainable. So everybody's doing a great job preserving it and using it appropriately. We must continue to follow those protocols to make sure we have enough supply over the next several months. But getting back to recovery, it is a bit of a concern as we get to 75 and 100%, because we cannot get back to where we were prior to COVID-19. We cannot get up to 120% capacity because we just don't have the resources. And with the physical distancing and the requirements there, the requirements to clean, we need to be respectful of making sure that we're doing a good job for the patients we bring into. So we have to start looking at doing business a bit differently. So now we're looking at what we call a surgical step-down unit. We're looking at a short stay unit for surgery. We're looking at what we call a clinical decision unit, where you come in, be assessed, see a specialist, and follow up with in a timely way with the specialty clinic over the next days to weeks that's required. So we're putting a lot of processes in place to make sure we don't have that increased capacity, not capacity, but the increased bad demand as we've had in the past. So in one way, it's gotten us to sharpen our pencils, look at new strategies to make sure we're having a more sort of timely response to the patient's needs, and maybe without having to need to hospitalize, even look at some virtual visits. Instead of putting people into admissions, we can have a virtual visit with the physician and the patient over the next, after discharge. So, or prior to discharge, not having to come into the hospital. So we're changing our business, and we need to change our business. This is going to take months and months to put in preparation, but we're just not looking at getting up to, that 100 and 110 and 120% capacity, because we just cannot do that anymore.
Okay, so some of these strategies you're talking about would be longer term, and planning something that you're looking at now.
Yes, our internal medicine clinic, we want to start now. We're going to start hopefully over the next couple of weeks. We're going to have an internal medicine clinic for individuals who need specialty assessment but don't have to stay in hospitals. We're looking at things along that nature, putting in place. We're looking at the capacity where we can put our surgical step-down unit and plan for that. So, I mean, this is all going to move fairly rapidly because we need to, because right now we're 50% recovery. We need to go to 75% recovery within the next few weeks, and then we've got to get to 100%, and then we still have that backlog. So we, even though it's short term, we have to move at a more hastened pace.
So what you're talking about is really achieving that balance. Now, you mentioned things like monitoring PPE supplies. So you're talking about monitoring those supplies to meet targets for 15-day and 30-day targets based on those conservation efforts. So we're looking to get to 50% right now. So when you talk about PPE supplies, are you talking about we have enough PPE if we are looking at 50% capacity of services?
Yes, right now we have an over 30-day supply of all our PPE supplies. But as we increase the number of services, we have to keep a closer eye on that because that could decrease to 15. And right now our bed capacity is about 83%. The ministry has said we need to stay, 90% or under from a regional perspective. So we need to keep an eye on that too. So it's a lot of moving parts that we have to keep an eye on, and we have a whole team making sure that we do not run out of supplies that endanger the safety of the patients as well as the staff in the hospital.
Okay. And another factor that we are monitoring to ensure that those non-essential services can continue, there's overall hospital capacity, which you mentioned, but also hallway medicine, which sometimes can occur in the emergency department. Our emergency department's getting busier, we're getting more admissions. So why is that happening, and how do we manage that to ensure that we can still provide those non-essential services for the people waiting in the community?
Right, Tracy. We only have so much physical capacity in the hospital, and I'm sure the majority of the population have been into the emergency department at one point or the other, and they realize that it's quite a crowded place. A lot of the reasons for the decrease in physical space because we had a lot of inpatients in our emergency department because we weren't getting people out of the hospital as quickly, and we weren't allowed to put people in hallways because of fire hazard. So now what we have to do is we're trying to make sure we have an efficient flow of patients, people coming in and coming out. And we get a lot of concerns from a lot of patients that we're sort of forcing or encouraging patients to leave the hospital before they're ready. But once medically they're cleared, we need home care services to actually be available to actually provide the service in the home because we just don't have the capacity here at the hospital to actually provide all the care the family feels that is required prior to discharge. So our role is to come in, stabilize, make a diagnosis, and get them back into the community where they do better. All the sorts of research says that they do better in the home environment and less potential spread of infection. And some of the recent, from the Ministry of Health, we cannot offer hallway medicine anymore. We don't have the physical capacity or the physical space to have people lined up on stretchers or chairs in the hospital anymore because that's not only a fire hazard, it's a physical hazard, and now it's risk for spread for infection.
It's really about enhanced safety at the end of the day.
Yes, it is.
Great.
It's going to be a different type of business in the hospital when you come.
I think so.
But we're here to serve the needs.
Absolutely. Well, and speaking of the needs, unfortunately, we have a new patient admitted to our hospital who is COVID-19 positive. So we're now taking care of a total of 4 patients who are COVID-19 positive. And in all of northwestern Ontario, there's been a little bit of an increase. So there's one new case in the Thunder Bay District Health Unit area. Outside of that, but the area that our hospital serves, in the Sioux Lookout area, there have been a number of new cases for COVID-19. Is our hospital responding? And what are we doing?
So again, this isn't unexpected. I still call it a trickle of COVID-19 patients. As you know, worldwide, there are now 9 million COVID-19 cases. Many have resolved. It's exploding in the United States where individuals are not doing their public health safety measures, which is, socially, physically distancing, wearing a face mask when you can't keep those 2 meters apart, washing your hands. And we've opened up travel now outside of northwestern Ontario. So this is not unexpected. We have 4 cases in the hospital. But we only have 6 active cases in the community, and we've done almost 18,000 tests. So our sort of not our capacity, but our ratio of positive tests to the total tests we're doing is like a 0.5, which is down from where it was 0.8 to 0.6. So although we're getting increased hospitalizations, we have 4 now. There's only, again, 6 in the total community, and only 19 total cases over the breadth of COVID-19 in the Thunder Bay district. So overall, we're still doing well, but we're going to continue to see this amount of individuals, patients, unfortunately, have COVID-19 as some travel restrictions, as business are sort of eased up, as businesses start to open. There's going to be potentially more potential spread out there. So that's why it's important not to ease up on those public health initiatives that I just mentioned. And as far as the areas to the, I guess they're the west of us, there has been sort of a number in the Sioux Lookout area been identified as COVID-19. And certainly that is a concern because it's a smaller community. But the health unit there is on top of it. They're following up all the contacts, and they certainly are doing testing locally and sending out testing to the public health labs. So I think you still maintain your vigilance, but certainly I think it's reassured that the public health, both here in Thunder Bay and the district, are on top of things.
Right, sure. And I mean, certainly the Sioux Lookout First Nations Health Authority and Minayawan Health Center, a lot of expertise in those organizations.
Yes, and when they don't, they can always sort of come to Thunder Bay Regional as far as assistance in any way we can.
Yeah, that tertiary care piece.
Yes.
Absolutely. So speaking of which, I've noticed that some COVID-19 positive patients who are hospitalized here stay for a very long period of time. Not all, but some. Why is that? What sort of care or what is happening that they need that extended period of care in a hospital environment?
Well, first off, as we know, 80% of COVID-19 patients do quite well in the community, and they actually just for symptomatic supportive care, they do quite well. They don't need to come to the hospital. But when they do come to the hospital, they're only admitted if they're having significant issues, and a lot of the issues is shortness of breath, increased oxygen need. They're factors that point to a significant concern regarding some of the factors you look at, like their white blood cell count. But more importantly, too, the ones that stay have other comorbidities. They have either some heart problems, pre-existing lung problems, diabetes, cancer. So a lot of the ones who are staying for a prolonged time, COVID-19 really affects individuals with sort of associated comorbidities, and that's why the majority are staying a longer period of time to take care not only of the COVID-19, but it affects on their other significant medical disease.
Okay, great. Okay, well, thank you for all that clarification today. Things are ramping up very slowly but effectively, and lots to look forward to with all of the longer-term planning.
Thank you, Tracie.
Thank you. We'll see you again soon.